Ladies, my name is Danielle. I'm here for IADH Now, and we're going to just do a short video today. You are two of our registered dental hygienists who are talking on the IADH program this week in Chicago. Maybe I can get you both to introduce yourselves. Catherine, you've just finished your presentation.
Yes, I am, and I'm relieved. So I survived it, but it was a real thrill to be here in Chicago presenting. It was a novel topic for me because as a dental hygienist, I focus more on dental hygiene topics and periodontics, but this is my first special care presentation, and it's part of my research. I was doing a scoping review in relation to the oral health interventions aimed at people with disabilities. So it's been great fun.
And could you expand a little bit on some of those interventions?
The scoping review identified the types of interventions that have taken place. So some of them are predominantly they're therapeutic interventions or skill-based interventions, which are interventions focusing on, say, teaching people with disabilities how to brush their teeth, or to help carers assist people with disabilities to brush their teeth. And then other are educational interventions or behavioural interventions. So there's been a whole range, and so that's why the scoping intervention review has been so good, because it's identified the types of interventions and how we then might look at each of those groups separately in a systematic way.
Great, thank you very much. Heather, so you're planning to talk on Sunday. Maybe you could give us a small introduction to yourself and to your topic.
Sure. I'm Heather Coulter Jackson. I come from Canada. I work in a pediatric practice, specializing predominantly in special needs, and we had a real need in the practice to find a way to help our children with autism to overcome their sensory issues. So I created a program that we call a patient-guided sensory integration, and what it does is we use all of the different modalities, 1,000 learning program, deep pressure, singing, repetitive tasking. We've put it all together into a program that's been very effective in treating our children with autism and spectrum disorders. Subsequently, we now are using it with any children that have any sensitivities at all, and it's been very successful.
Well, great. And you're going to discuss that program specifically. Do you think, have you any plans to make that program accessible for the rest of us to borrow from?
Absolutely. I have a plethora of videotapes, so I'm showing a lot of video. I can't show everything I have, but I've got it outlined, so it's fairly easy to follow.
Great.
So everyone's welcome to have it.
Ladies, thank you very much for your time.
Bye. Thank you.